Hey guys, we are super excited to be announcing that we are part of the second annual Black Effect Festival in Atlanta, Georgia.
So if you're bringing your kids this year, just do this. Just do this the whole time because it's going to be a wild and brand new show that you didn't see last year.
The date is Saturday, April the 27th. Make sure you head on over to blackeffect.com and get your tickets now.
See you there.
Hey guys.
No, you got to say howdy.
Oh, howdy, y'all. We will be in Dallas, Texas Memorial Day weekend for the TwoGether Land Festival, headlining May 26th. Make sure you get your tickets now at TwoGetherLand.com. Let me let y'all know what this lineup looks like. Wayne, Jeezy's on there, Summer Walker, Drew Hill, bitch. Come out and also see us. We are headlining the podcast stage.
Say it again.
Headlining. Headlining.
And if you're good at giving that, jump on stage with us. See you soon.
Hi guys, welcome. It's another episode of Horrible Decisions, and I'm speaking this fucking professional because we have a doctor in the building. It's giving science, and guys, I can't wait to get into the goddamn conversation. Anyways, guys, I'm your girl, Mandii V, aka Pet the Stallion, aka Deadbeat.
I'm a person that does believe in science. My name is Wheezy. If you're watching on the YouTube, yes, this is the fake Beyonce outfit from tour. We got an email in, probably your PR team, I don't know. But anyway, you know, we had a lot of emails of guests that want to come on. And I was like...
And we ignore a lot of y'all niggas.
I was like, sorry. I was like, we've already had a guy on. But then I started clicking and I was like, okay, it's a black man. We never had a male guy on. And also, I was like, the tattoos kind of got me. It was like, is he a real doctor? You know what I'm saying? Because you remember the guy that had that little fake certificate.
Yeah.
So I wasn't sure. And then I'm like, do he just want to look at pussy?
So who do we have in the building today, Weezy?
Dr. Michael Reed, the cosmetic GYN.
Yes.
So you don't only go into pussy and deliver babies. You want to fix it and make it a pussy.
You reconstruct pussy.
You see what men do? They want to fix it.
We fix it.
What be wrong with it?
Well, it's not me, right? But when you talk about men, we're just happy to be there. This is for women.
Mm-hmm.
Women are saying, I want this or I want that. And guess what? I give them this or that they ask for. It could be anything. It could be, I don't like the way it looks. It could be, I don't like the way it feels.
What about smell?
Smell, you can't help that too.
Okay, we'll get into that. By the way, if y'all are watching on our YouTube, Dr. Reed has a wonderful pen.
Yeah.
And where
P-I-N.
what you thought of, like a pen, like what you write with?
They can't see.
That's what I'm saying. He has a lovely pen on his coat jacket. And where Weezy thought it was a flower, it is the flower of Mother Nature. I want this goddamn pen of a pussy. And I would like to start off, before we get into what you're able to do, how this started with your profession. When did you know that you wanted to be a cosmetic OBGYN and deal with the vagina, not only on a personal level, but on a professional?
I feel like everybody wanted to be in it all day, but yeah.
So, I mean, you know, I'm a traditional OBGYN. That's how it started.
Okay.
And I've been practicing 24, 26 years.
Practicing
OBGYN, right? And so I would say maybe 5 years ago, I had this feeling that, you know, what drew me first to medicine and OB was caring for women, you know, making sure that I could do everything that they needed to do, deliver babies, be supportive, encourage, and treat, right? And can you believe that's what got me there? But one day I said, it's hurting me. It's draining me for some reason, right? And I said, I got to try to figure out something to do. It's one of the difficult things for physicians is that there's no place to turn when you get
bored.
Well, that's a nice way of saying
okay.
it. Yeah.
you did say
I
it.
lost my passion. You was bored looking at pussies all day. And you was like, what else can I do with the pussy?
How many years in did pussy become boring? Like when you
17, 16, 17 years.
Okay.
Okay.
Yeah.
So at the beginning, because I feel like every man watching this wants to know. You're starting off with clients.
Yeah.
In the beginning, are you like, oh my God, this is a good one? Is it the person? Is it like, when do you stop thinking for yourself and become total doctor?
As soon as I walk into my front door and turn the key.
I know that's
How you mean I'm lying? Look,
Ain't no way
I'll
you
show
ain't-
you. Listen, here. I'm going to tell you, you guys are women. You guys are sexual. You guys are prowesses. You guys are champion. You guys are leaders.
Prowess is, mm-mm.
And you can.
I don't be on the prowl. I don't
But
chase
you all
these
feel-
niggas.
y'all
Call us a harlot.
But you all can feel energy, right?
Right.
Mhm.
So,
I've been called a siren.
so if you're coming in to see me and I'm looking at you with a different energy, you're going to feel it immediately.
Facts.
Right.
And so I want to change the landscape for women as it pertains to their sexual enhancement or gratification. So if I'm going to try to do this for all women, well, then all women is business, right? The only business I have, fun business, is at home, right? So I want to change things. So I can't be this person, whether it's behind the scenes or outright blatant. I got to be who I am. And that's to change things.
I love that.
That's what all. So
That's where the
when
money
you
at. That's
ask,
what he said.
when do I really turn this on?
Yeah.
When I go into my office.
Have you experienced moments where you're almost seeing it so much that when you get home to your wife, you're like, I've had enough?
I
No.
feel like we asked this question to point
No,
hard.
no.
Yeah.
Right.
No, because remember, I turned it off. And I'm a man. So as soon as I go out the door, I turn it back on. And when I turn it back on, I'm looking at everything. I look at, if I'm at the beach, I got some, I'm going to look there. I got the same feelings, same thoughts, same things that men do.
Have you ever got hit on by a well, I know you have. Tell us about a time.
It was early in my career. So what I've learned, because I've opened a practice in North Carolina, Nebraska, and now Sacramento. And so what I've learned is when you first come out, see, I feel like I'm high value, okay?
Oh,
so-
Lord.
Yeah, I'm coming
High
with it.
value black man.
Well, you laugh. I know they feel.
OBGYN.
Oh, Lord.
Yeah, the way we just hate high value, we got to get you another word for that.
Okay. Well, I think I'm a great person.
There we go.
All right. And like I said, I want to be the best, right? So, having said that, what was the question?
When you get, tell us about the time you've been hit on.
So
High
I was
value.
setting that because you're gonna have to help me with that. I was
Yes.
setting this up. So, like I said, you got to be all right and everything. And I got a letter from a patient. That's what I got was a letter.
That's real old school.
Yeah, this was a long time ago. You got to remember.
Oh, it was an old time. Okay.
This was a long time ago when I first started. She said she was going to do this, that, and everything else too.
Yeah, 17 years ago, there wasn't even cell phones.
You had
Mm-mm.
already been up there. She was a patient.
There
Yeah.
wasn't. The only cell phones was the little big old thing that they put in the car that we saw in like New Jack City and shit.
No, they had
I'm
cell
not
phones
that far back, I
17
don't
years
think.
ago. Girl, we were in high school.
Not 17 years ago.
Are you fucking Mandii?
I'm doing the math. Bitch, I ain't in accounting no more. That just sounded like a long time ago. We had cell phones? I had it in 8th grade. Let me do the math.
Girl, we are old.
Okay. No. Speak for yourself.
Okay, wait, keep going. So she wrote you a letter. What about when you're in it? You never had someone when you're in it be like, well, hey, if you want to see it outside of your gloves.
Nah, I haven't had that. Because, listen, like I told you, when you first come in, you're shutting it off, right? And then the patient can feel it if you are not on or off, right? They can feel it. The last thing is that if you set yourself up and people know
They do.
that you don't do these things, then those pressures go away.
What about some weird requests or even boundaries you've had to make? For example,
Mm-hmm.
we saw T.I. online saying that he made the doctor make sure his daughter's
Check the
hymen
hymen.
was there. Have you ever had any fathers just have ridiculous requests or something that you felt like?
That's entirely ridiculous. Sorry, T.I., but that's entirely ridiculous. The hymen breaks, at 12 years old. I mean, you could be running, you could be riding a bike, you could do anything, and the hymen breaks. So it has nothing. I mean,
So
I
that
don't-
is a myth. You're cherry popping, your hymen breaking
Right.
from penetration.
Did yours?
That is a myth.
that is a myth.
I did lose
What?
it. Mine did pop from penetration. Did yours?
My period started. But I know my body like that. First off, it was just the head it went into, so I don't think it really broke.
Oh, so yours did it.
I don't think my hymen broke. But
Mine must have been real low. Nothing happened.
My,
It just
my period, mind you, I started my period maybe only 4 or 5 years before I lost my virginity. So me understanding my body or my cycle, I was just waiting for blood to come. I ain't know when that motherfucker was coming. I just knew it was coming. And so I do believe, I had a full period. I didn't spot. I had a
okay.
full period. So I was like, I hope I ain't getting this nigga car.
Anyway, so have you ever had a father or mother come to you about their kid's virginity or something that you said, this is unethical, I can't?
No. No. Mm-mm. I haven't had that.
I guess the weirdos are in Atlanta.
Well, not the weirdos are in Atlanta.
Well, what about husbands?
Ooh.
Are husbands ever coming to you maybe saying, hey, can you influence my wife to maybe take some estrogen? Maybe this or that? Or
No, the best patient is when both the husband and the wife comes in, right? Because it takes two to tango. And so one of the things that I want to do is try to get them to see what it is that's going on so that they can be honest with each other.
Mm.
Because what we're really dealing with aren't these procedures. We're dealing with the most awesome thing that we all enjoy, which is pleasure, which is intercourse, which is intimacy and being together.
So
right?
Are you more sexual health focused than you are regular gyno?
Yes. Yeah, that's what I let go of.
I love it.
I let go of delivering babies because when you guys go to an OBGYN, that you go in and they do a pap smear, they give you birth control, talk about that or not, yes or no, do a STD check. And if you're at the appropriate age, they tell you to get a mammogram and they tell you to go on out the door. None of those things actually involve the real life concerns of women, especially the modern day women.
I will say too, with my brand, like Period Sis, a lot of women have talked about their traumatic stories with OBGYNs. And unfortunately, a lot of women that go in with concerns are literally told, here's birth control, this will regulate everything. And it's not always the answers because there's PCOS, there's endometriosis, there's all of these things that actually affect the cycle. And so I love that you're like, it becomes almost like a business, unfortunately, where we come in for our yearlies. Mind you, back in the 90s, 80s, 70s, it's called yearlies. We're not being told you really only have to go maybe every 3 years.
Yeah.
They're not even telling women. They're also not administering mammograms unless you're a certain age. My best friend literally was diagnosed with breast cancer at 34. And now we're being diagnosed at an earlier age. Another one of my best friends decided to keep a child because she's had so many fibroid removal surgeries that her becoming pregnant is almost as a miracle.
Yes.
And so there's so many conversations that aren't being had. And I love that you are a Black male doctor wanting to just be that ear for women that go beyond, like, again, the yearlies and that. Y'all, look, I'm trying not to get emotional because these conversations with my friends recently, they don't feel safe with OBGYNs.
Yeah.
And I love that we have you on here because I wanted to really dig into that, where clearly you're now leaning towards the cosmetic route where you have these other conversations with women. But for our reproductive health, I'm not sure where the mark has been missed in education or with whatever practicing you guys have to do. If you don't mind me asking that. You as an OBGYN, where do you feel like that mark is missed, where the care specifically of Black and brown women is missed upon in terms of them coming into your office and expressing pain, irregular periods, and things regarding their reproductive system?
There's disparities in health. What are you talking about? We know that. Black women are treated differently than Caucasian, Asian women, all the other women. One of the things that I did when I first started is that I put my practice was gigantic. I have a gigantic practice. I had a gigantic practice that I left. I would say the majority of my practice was probably 60% African American and 40% everything else. And everything else came later. African Americans came first. And my mission at that time, which still runs, is, hey, you're going to get the same care whether you go to a white doctor or you go to a Black doctor. In fact, you're going to get different, more personalized care, and you're going to know that you have an educated physician. I work hard to be mentally strong. I work hard to be a warrior for you too. You know what I'm saying? So when you come to me, you're going to get the same care you're going to get anywhere else. And the other thing is that we don't listen. It's very difficult. And I think some of the disparities come about because you don't look like the doctor. Do you understand what I'm saying?
Like literal.
Yes.
That's a very
I'm being frank. You guys are straight hit. Exactly. Personal connection, which brings you in to make you want to find or push or do that extra. Right. So when you think
because the way maybe I'm expressing pain to you, now you view me as your mom, your aunt,
right.
your sister.
You remind me of my aunt Lisa. Aunt Lisa. Whew.
Shout out to Aunt Lisa.
There she
What was wrong with her?
Shut up.
Aunt Lisa, you remind me of her. So when you coming in, I see her, right?
Mm.
And so when you telling me you got pain, I ain't going to say, oh, it's just PID. I'm going to say, okay.
It's anxiety. It's
Yeah,
stress.
yeah. I'm going to say, what else is going on? What should be happening anyway? But one of the things that I really try to do is I want to do that for everybody. And that's why my practice is so diverse. Because when they do come in, they go, wow, he's smart. He cares. He feels. I have so many ladies that come in, they're nervous. And by the end of the time, they're talking to me. And I just give you a
spread
their legs open.
That's the bitch that wrote the letter.
Yo, you know what? This is horrible decisions. We want to have a quick icebreaker because this is getting really scientific.
All right,
and we want to have some fun with you.
Okay.
So you started a series on your page.
I'm only on letter D.
So now we going into it. So you have the ABC.
That was so crazy.
Of what's the game called?
Gynecology?
Yeah, cosmetic gynecology.
Sorry, my bad.
I thought you were going to say gonorrhea.
No, bitch. Now that could be the G. Anyways, Weezy and I, when we first started touring, we used to do this thing where we would have to go down ABC and list porn categories, right? However, for the ABCs of gynecological cosmetology, bitch, these are some big ass motherfucking scientific words. What we want to do is Weezy and I are going to literally pull a letter
Okay, let's
out
do
of
it.
thin fucking air
All
from
right.
A to Z.
All right.
What we want you to do is name something that relates to that letter, and then we're going to dive into it.
No,
by the way,
have
we
to
have
start
props,
with
so let's have fun.
That was crazy.
Do what?
No. So by the way,
The
on
A.
your page,
Oh.
A, y'all, this motherfucker said anal skin tags. Now, I just
Why
want
don't
you to know.
you pull out
No, okay.
so we could hear a little bit about A?
Now, what's crazy is, let me tell you, I just started, this is a heavy Buddha hole, baby.
Mandii is, by the way, for everybody not watching, she is pulling out a big, is it silicone?
Yeah.
We might have to blur this if y'all watching. Anyway, let me tell you. So I watched your video and I literally sent it to Weezy today. And I'm like, anal skin tags. So I got skin tags underneath my armpits.
Mm-hmm.
And of course, I learned from when I go to my lasering that skin tags are very prevalent within the Caribbean community. Because of our melanin, however we shave, we are more susceptible to skin tags, which literally, if you have it, it's just like extra skin that just hangs. You do have to have it cosmetically removed, which I learned.
Yeah, tell us a little bit about
what is that anal skin tag? Hold on, we got to talk about the boot hole.
Okay.
Anal skin tag. Let's get into it before Weezy gives you another letter.
All right. Anal skin tags. They're pesky little critters, you know? They get in the way.
Not to be confused with a hemorrhoid.
Exactly.
How do you separate the two?
So a hemorrhoid is going to be painful. It could be red. It'll hurt. It'll be uncomfortable, and you'll want something to be done right away. Anal skin tags are more of a pesky little thing. It gets in the way, makes it a little bit more difficult to clean.
It just don't look as cute, too.
It don't look as good. And then I know you, so you might not want
Y'all,
tags
he
there.
is jamming his finger into the air.
Not the knuckle girl.
Yes, that's the knuckle girl.
So if someone, the knuckle girl is
The knuckle girl is crazy.
My Aunt Lisa was a knuckle girl.
No, she wasn't. Well, she could be. I don't know.
That ain't what we share at the family
Right.
reunion.
Yeah, she didn't tell me that.
So when you first saw anal skin tags, like, are people like, yo, I keep trying to wipe it and I think it's shit and it's not?
No.
Or is it a pimple? What do they think it is?
They know what it is. Most of the time, they know what it is.
Okay.
And they go to their OBGYN, usually, and they look, they say, what is that? They say, oh, that's an anal skin tag. That's normal. That just comes from pushing in hemorrhoids. You don't need to fix that. If you want to, you can go to a surgeon or something. So then they go to the surgeon, and the surgeon says, yeah, those are anal skin tags. That's cosmetic, you know, not much there. Love the Hermes bracelets, by the way. And nothing's done. But what she's really saying is, I don't like these things. I don't like the way they look. I want to feel better about my own self. Can you help me? If it ain't broke, they ain't messing with you.
Doctors, which is why, let's make it very clear, which is why cosmetic is now in front of
gynecology. It's a term.
Right.
It's just a term. So we're board certified. We're OBGYNs. I do everything I'm supposed to do to keep that certification. But I got to be able to communicate to you guys. I got to say, I'm different. I'm going to listen to the real life concerns of the modern day woman. Right? So now when it comes to this anal pesky skin tag, I'm going to take care of them.
Now, what about M. Just give us any term you could think of.
M.
Majora. But that
Ooh,
starts with labia,
that's
no.
my favorite. That's one of my favorite. Labia majora.
Ooh, that sounded nasty.
Ooh,
That's my favorite.
labia majora.
So that is what you're mainly working on in cosmetics, right?
No, I work on everything. There's not much I can't do to the vulva.
Now, let's flip it. Hold on.
Bitch. That's V.
Right.
No,
V
labia
cold.
majora. Labia majora is like
It's a bigger outer lip.
But labia come first.
No, I'm saying I thought mainly when people want to come in for cosmetology, they want that trim. Like I always thought that was probably the number.
Yeah, so you talking about the labia minora.
Minora, not Majora.
Not Majora,
Yeah.
bitch. Look at
So let's
what you know, Heaux?
yeah.
I say the science is iffy. It's tricky.
Okay.
So we're gonna do all this.
Okay, let's get a
for
quiz.
for your audience.
Okay,
So
talk to it.
this
You bitches
is-
That's the lips.
Okay. First, this whole thing is the vulva.
Whole thing, the
Whole
vulva.
thing is the vulva.
Whole
That
thing,
we
the
knew.
vulva.
Uh-huh.
All right.
Uh-huh.
Outer lips are the bigger ones. Those are majora, right? And then the inner lips, minora.
Oh,
Like a Jewish.
whoa.
Like Hanukkah.
Okay.
What?
And then you got the clit.
And then you got
The
the
clitoris.
clitoral hood. And under the hood is the
Engine.
clitoris.
Little dot.
And that's only part of the clitoris. I think there's a little clitoris in that bag too. Right here is this little area is the urethra. And then this pink ribbed area, when you do check yourself and you'll feel a rib. Yes.
wishbone.
Yep, it broke.
This the wishbone.
Yeah.
That
Was the clitoris and it broke.
Hold on, go back to the inside.
Yeah, so the inside, it's ribbed. It's right up here on the anterior vaginal wall. Right?
And is
And
that
that's the G
G
zone.
spot? Okay.
G zone, G spot.
Why don't you call it the G spot? You call it zone
Because you're not turkeys. You know, you don't just poop and a pop and a little spot. You have an area. You have a vulva. You have it. Some women like a little more touch on the side. Some want across the top. Or you want it here. It's not just one spot. It's an area or a zone. Right.
Now, when looking
Like
at
zone
this,
6 in Atlanta.
what are different things that you could see maybe when patients come in, they're unhappy with? Can you point to some of those things?
One, labia majora, labia minora, anal skin tags, clitoral hood.
What do they want done to the hood?
Well, there's a couple things that you do to the hood. So there's a condition called lichen sclerosis that affects women, where it causes the labia to get smaller, things stick together, kind of that shrink, don't lose it. One of the other things that happens is that hood will stick over the clitoris like this. So how are you going to get access to it? So you're not going to be able to feel it, and sometimes sensitivity will change.
My shit too sensitive. I need to desensitize.
I mean, I guess I'm more into the zone area.
Uh-huh.
So because I come off of vaginal penetration.
All right.
Like you can't eat my pussy, but it's not like ooh. Like it's cool. When I come by myself, I like my clit played with, but when I'm with a partner, I enjoy the penetration aspect of it.
So maybe the
you're
O shot would be something that's like.
So I think the one of the other things that are really great, it's a tool too. It's a tool. It's called Vag Angela.
Oh yeah, what's that?
It changed the angle of the vagina. All right. So the vagina, this is the vagina. The vagina has a downward angle on purpose. I'll use this hand, downward angle. So that, remember, up here is the clitoris. We just talked about the G zone, which is in the anterior vaginal wall. So there you got an angle. So it doesn't matter the size of the penis at this point because you have the angle.
I don't like that you just said that. Calm down. Hold on. We're going to retract.
I didn't watch that one episode. I saw it, but I didn't have enough time to watch.
First off, why does the size of the penis not matter? Let's get into that.
Yeah, that sounds fucking insane.
Because
you can get out.
Well, I don't have a vagina, so I don't know.
The episode is
you don't. Well, go ahead.
So what I'm saying is,
so the size don't matter because
of the angle. All the sensitivity is at the upper part, anterior vaginal wall and clitoris.
So dicks that curve up are superior, is what
They
you're
might
saying.
be. They might be.
I don't like them.
There you go. Not good for her.
I'd be like, hey, now I gotta go left when you go right.
You poking a little way.
Actually, I want to have a little bit of vulnerable moment with you because Mandii sent something that said, "Oh my God, he does surgery for vaginal dryness." I've never heard of that. So last year, actually the year before, I was on antidepressants, and it was very humbling for me not to have no little wet coochie no more.
Mm-hmm.
So I had to go through hormone therapy, and it was really tough. I mean, when I tell you I was on Vitex, this Chase Berry, I was taking every fucking thing and it just wasn't working. And it was so upsetting because I was like, damn, I feel like the person I'm with can feel me. And Also, I understand we're supposed to be like super sex positive about lube, but I'm in my 30s, and I'm early 30s. I don't want to pull this fucking bottle out. So I'm curious. Now I'm better. But I'm curious to know, can you give some advice to women that are experiencing vaginal dryness that maybe medication like myself that aren't going through menopause?
I was going to say perimenopausal as well, like where they're not fully there yet.
But I mean, this is a lot of young women listening to this mainly. So
right.
Maybe they went out and just had too many pickleback shots like me when I literally finally I had the time to fuck this nigga. I've been wanting to fuck my whole life damn near. And baby, I was embarrassed by how dry my coochie was. But it's because we had been drinking
but I'm talking about
all
regular
night.
If a woman's experiencing regular vaginal dryness at a younger age, like what would you recommend, and have you seen that?
Sure, you see it. That's part of the early things that happen. So there's a few things. Hormonally wise, in your 30s, late 20s, your testosterone level will begin to drop.
Okay.
Testosterone is one that gives you the confidence, the swag, and makes you want to have sex.
Estrogen give us that confidence, but okay.
No, I'm telling you.
Let him be the doctor, man. He did.
Testosterone is just giving real masculine. Okay.
Yeah, it makes you horny, increases your libido. Then estrogen also is a wonderful hormone that your vagina loves. It stimulates the cells to develop, become larger, and secrete more mucus. And that's what makes you more wet. Like when you're pregnant, neither one of you been pregnant because I listened. You ain't had none, don't want none. You don't.
She done had a few.
Yeah.
Sorry. I mean, a couple. We talked about it on the pod.
Okay, Manny, damn.
But I'm just saying, we've both been pregnant.
No, I'm just saying, like, I had one, she had a few. I was 17 and 25. Okay.
I know, but we've talked about it on the pod. It wasn't shady. I promise.
Okay, keep going.
Sorry,
Let's get to this point.
So what she can do is, one, we could check hormones, but if she's young, she needs to stay hydrated. Make sure she drinks lots of water. Two, you need to think about what different procedures are available. You can do Thermiva, which I call a magic stick. You can do laser, which helps with increasing blood flow and lubrication.
Now, what laser is someone doing to their vagina?
Laser. There's a few lasers. Fractional CO2 laser that you can usually use.
You said Thermiva, and then you looked at what you actually brought.
Yeah.
What does this do for a woman with her vaginal dryness?
So it will stimulate. You use it in the vagina, and you warm the vagina up, and it slowly warms it up like a hot stone massage. You know, like when you go get your pedicure. Slowly but warmly, it gets it done, and that stimulates the vagina to increase collagen and elastin and new blood vessel growth. Now, when you get new blood vessel growth, that means you're carrying more water. So if you're staying hydrated, you're going to feel better. If you have more collagen and elastin, and the cells are going to be plumper, the nerves are going to be better, you're going to respond, and you'll become more lubricated.
Can I ask you, for this one specifically, so I went to a dungeon and experienced electromagnetic waves inside of my pussy for the first time, and it felt like there was 8 tongues eating me from the inside out. Now, with this therapy, you do this, or is there a way that a person's partner could do this for them? Because this to me does create a stimulation where if I'm in a doctor's office and I feel this level of stimulation, I don't know if I want to be aroused as a patient.
You better do like I do. Turn it off when you walk in.
So I have the butterfly pelvic floor therapy. That's not the same, is it?
What's the difference?
Wait,
okay.
Well,
listen, I haven't heard the butterfly.
Well, they call it the butterfly, but basically, like, I had some sexual trauma when I was young. I've talked about it on the pod before. Not young, but like
vaginismus. Dealing with that.
Basically, I had a partner that was super abusive, and I got my body would tighten when we had sex, and
that's
so
what vaginismus is fear,
right? But they said that I had to do pelvic floor therapy, and it was with a wand. But
but that's a glass wand.
Yeah, I don't think it was
usually use. It's a different wand. It's a wand that you use like in massage. So when you have backache, right, and your back is hurting, you go to rub it, you feel those 2 little knots and everything in the vagina. Well, your muscles of the pelvis can get knots and tighten up. Now, you're in a relationship. Vaginismus, whenever I hear vaginismus, that means there's fear of some sort because you're tightening up before you, whatever it is. So there's a fear there. There's vaginismus. It's a fear.
And for people that have not heard of vaginismus,
go ahead.
I want to make sure that.
Oh, by the way, I'm going to use that as V.
No, V. I love it. We ain't even throw V out there. But vaginismus is definitely like if you are experiencing painful sex.
Yes.
Maybe you don't know why it's painful. Maybe you think you're dry. Maybe you think your partner is too large. But that fear and that cramming up psychologically is where your vagina muscles are strengthening to where
Well, they just
you now
tighten
don't
and
feel safe
Yeah.
having sex.
exactly. And so your mane tighten and the muscles just remain tight and in an uncomfortable position. And so you go to a pelvic floor physical therapist because it's like going to a massage therapist, and they just work that pelvic floor and work it and talk to you and get you to understand and try to break the cycle that's there. There's a cycle there. And if you break that, then you can break the pain.
As an OBGYN, have you had a couple come into your office where they're both expressing that sex is not the most pleasurable for them? And then the woman had to maybe take you aside and let you know that psychologically she's not there because of how this person is treating her? Like, what has been the conversations with couples who have come in?
So generally you got to come in when a person comes in to see me about sex. Best sex organ is right here between your ears, right? So if you're in the wrong state of mind, or if you're not pleasure, or you've been working your ass doing podcast off and you coming home, if you ain't in the mood, it just ain't going to be there. So you got to talk about those things first. So what is it that you're trying to improve upon? That's the first question I ask.
What has been the common thing that's been an issue in relationships besides vaginal lubrication, or like what's been an issue?
Usually it's not that, like I told you from the beginning, it's not the man. The man will say something if the woman will. But 9 times out of 10, we're happy enough. We're happy. It works because it's us sharing. So most of the time it's the woman that's coming to, and she's saying, I'm doing yoga or Pilates, and when I do I hear air go in my vagina, or I hear air come out of my vagina.
Oh.
Or I used to use tampons, doc, and now my tampons are falling out. Now I got to use the maxi pads. Or when I'm sitting on the toilet and I sit down, I go to wipe, I feel something I ain't never felt before. What the hell is going
Your
on?
pussy's falling out.
Yes.
Not the pussy falling out.
Yeah. See, all these things are happening. And what happens is that they go to the OBGYN and they say, I'm feeling something. It ain't right. And they look and they say, everything's fine. No problem.
Now, what is the average age for this?
Oh, it can happen at any. When are you going to have children? Children affects the pelvic floor as well as age affects the pelvic floor.
So should I get a C-section and just ask for one?
You can, yeah. But that doesn't necessarily think it's going to remain that way. You're going to do far better than you would if you deliver it through. But that is not necessarily the case because you hold the baby down in the pelvis.
Down. Right.
Yeah.
I want to ask you something that compares to me science versus spiritual. So when I broke up with a relationship that I viewed traumatic, my hips were the tightest they had ever been. I couldn't walk certain ways. When I laid, I couldn't stretch. When I did my bar class, it hurt. And so many women DM'd me and was like, oh, it's because you carry trauma in your hips.
Mm-hmm.
And the body keeps score. It's a book you need to read.
Yeah,
and
there it is.
And so I want to know if that was my experience, not in a holistic or spiritual way, scientifically, why or how that happens. Because, of course, I'm not a stars and moons bitch. So everyone's like, oh, girl, it's because you're psychologically, you're sad, you're grieving. All of this lives in your hips. What would you say to a patient who comes to you? Do you get into holistic medicine? Are you spiritual in?
Yeah, of course. We talk about it, right? You got to talk about it because we know in medicals, when we go through medicine, we're always told that there's a mental part with it, a biopsycho and social issue with it.
Psycho,
and social. So if just think about your kid. Well, you don't have kids. I got a whole bunch of kids. I got 6 of them. But you got kids, and then when they so like when
you delivered all of them,
I deliver 4 out of 6.
Okay.
So when you think about kids, when they get sick, all of a sudden they seem to regress a little bit. You know, like if you have a kid that's been off the bottle, but when they get sick, that's what they want is the bottle. So there's a psychological aspect that's feeling the pain and discomfort that they're having. So you had a biopsychosocial phenomenon. Nothing wrong with it.
Wow.
You understood it. You fixed it. Did you not?
It took a while. I had to detach from sex. Like I realized that where I was trying to fill the void of a sexual relationship, I went back to who I felt was comfortable, but I felt empty. And I think it led to my hips feeling even tighter.
You didn't want to open up. Yeah, you didn't want to do it
with anybody. Like literally from cuddling to just being around them. Yeah. I literally did not feel comfortable. And so many of, shout out to the Whore Hive, so many of the listeners, like as I was expressing this, they're like, oh girl, it's because trauma's in your hips. And I was like, No, not y'all making me a spiritual bitch. But as I like started going more and more to bar class, but also just in therapy, working through my traumas, I did my hips. Like I was able to start opening up a little bit more. And yeah, it was interesting. I didn't know that connection. Y'all make sure you get your tickets. May 5th, we are at the Earth Theater in London.
Listen, all the black people that live over there, just take that Eurostar and come and see us. We're going to be there May 5th. We are having a whole new show, one that you didn't see. This is a part of the Climax tour. Come through and see it.
Make sure you head on over to whorehive.com and get your tickets now.
I do want to get into some stuff about your patients.
Ooh.
So I want to know
now.
about trans women. Have you worked with any?
I haven't worked with I can't do much with trans. I'm an OBGYN. The most that I can do with trans, which kind of goes along with what you were talking about, labia majoroplasty, the scrotum becomes the labia majora. It's actually the homologue to the vulva, right? So sometimes it's not put together as pretty as they would like it to be. So there's some different techniques that I can use to try to maybe tighten it, flatten it, smooth some things out, and make things look a little bit different, but I can't do anything more than that.
What about trans men that want to enlarge their clitoris? Like, have you dealt with any trans men?
Not in that aspect.
Okay.
Yeah,
but I have had to enlarge clitorises.
You have? For what reason?
So as you age, good thing for the audience, as you age, the clitoris will get smaller.
Okay.
Right? As men age, their penis will get smaller too. So there's lack of sensitivity. Sometimes it's too small and you can't get anything. So you can use a little testosterone in that area and gently do that over a small amount, a prescribed amount, how I would ask you to do it. And you can see growth in the clitoris and maybe hopefully improve sensation. I can also use that magic stick and use and warm around that clitoris. And it stimulates small nerve fiber density. It stimulates blood flow.
To bring it back, the nerves back.
Yes, the blood flow.
What about when it comes to kink? I had a friend of mine who was an ER doctor who said there were a lot of kinks that people did that caused trauma to the body. I remember one specifically she talked about was eating batteries, like some crazy shit. Are there any kinks that you've seen done to the vagina that, whether it be like gaping or something?
Yeah, those things are obviously going to change the pelvic floor, right? The vagina is resilient, right? We can have babies, it'll snap back. It will after a couple times, but if you're using larger toys and you use it, your body, after a few times, your body says, oh, you want me to relax a little bit. This is coming. I need to make room. This is how you want me to be. And so you'll get more relaxation. And so you get a bigger toy. And the next thing you know, you got...
Wait a second. So you're saying that someone's vagina...
Which is a myth.
Hold on.
Yeah.
Can change with toys, but not with babies. Like, I want to get into that because there's also this idea of miles. There's this idea of looseness when it comes to the vagina.
There's nothing to do with miles.
Specifically, if you take
so if you got a big dick,
then
it ain't really if you fucking too much. It's if the dick is big. Then
no, that's what I'm like.
That's what I'm saying. Right? Exactly. So if the dick is big, oops, did I just say? You guys got me.
You did.
Oh, you want to mark that?
No, you don't have to.
Oh, okay.
Yeah. So what that would mean then is if you had a larger person than your partner, one or two times, then it ain't going to change.
But if that's your husband,
then it's going to change. It's going to accommodate.
Interesting.
Interesting. Jet Set and Jasmine.
I was about to say.
We done seen your husband.
Huge.
And I just got to say, I want to know what that pussy feel like to somebody else. What is that man saying? But you know what's crazy? She literally said on the show, oh, he has to see other people sometimes.
Because she wants a break from it.
Yeah.
Because it's so big.
That's damn, I feel bad for her.
Not you feel bad for her. I love that for her. I want someone so big that I have to share it. That's actually a dream.
Have you ever had someone want to do tightening because their partner's smaller?
Oh, yeah. A lot of times.
You don't just tell them to have anal sex?
Well, it's different, right? There's a difference, right? The anal sex is going to stimulate one aspect of the penis. It's not stimulating all the way through the vagina. So it's just a ring and you're going to just feel that ring, but you're not feeling anything beyond.
So anal sex let's clear it up, does feel different.
Does feel different.
Than vagina sex.
Yeah. But there's other reasons why a man might want anal sex more, right? Maybe he does. That's a sign. That's one of the signs.
Well, what's the sign? Tell us the sign.
If your husband or partner is asking for more anal than they usually have.
That pussy done kind of...
Yep.
That is not... Don't do that.
That's true.
Don't be putting
Yeah,
that out, though.
Can I be
That's
honest?
what. That's.
So
I
wait,
mean,
if a man is saying
if he's
you guys
asking
are
for it that much.
yeah,
It's because he's bored with your vagina?
you want to feel the tightness, or
He's not saying that asking for it means that. He's
No.
saying asking for it frequently.
yes, and more often than you're going like, why is this?
Why he
Why
only
you
want to
keep
put it in my
asking?
Buddha hole?
Yeah, what's wrong? That's what it's made for. Why you right? Then that's when you need to start asking some questions, but don't ask them in the bed.
I was
Don't be
no.
like,
I
is
agree.
something wrong with it? Don't do that.
Conversations like that should never be asked in the bedroom.
Right.
So then let's get into that. How would a woman respectfully to her partner ask why her man is now asking for something else? And I only ask that too because it could go both ways, right? Being on tour with tonight's conversation, a lot of men are asking for their butthole to be played with and don't know how to ask for that. But you're also saying if a man is asking to have anal sex with you, he may be wanting to experience it because either the hole's not as tight or could there be another reason? But also, how does this
Yeah,
conversation
it could be other
happen?
reason.
How do you have this conversation with your
That's
partner?
why you have a cosmetic gynecologist, because I can talk about sex, and I'll say,
And you talk with couples about
yeah,
this?
Do
sure.
you feel like you get into a therapy mode?
Sometimes you do.
Tell
Yeah.
us about a time when couples started fighting.
I had a lady that came in, and she had a lot of relaxation, and it was a lot. It was going to be a very difficult case.
I love how you
And,
said it. She was open.
And
What was her age and children?
she was, I think she was in her 40s, and she had 6 children.
Okay.
So you get a picture now,
Yep.
right? And
That thing was
she
winking
wanted
at
it. She wanted it fixed. She wanted it fixed, and he was like, "Hell no! What the hell? Ain't nothing wrong with it. Feels great. It's wonderful." She said, "Never mind him," and kicked him out the office.
Wow.
And so we had the conversation, and she was like, "Ain't nothing wrong with his penis. I love him. He's great. I ain't feeling what I want to feel."
Oh, wow.
Oh, wow.
So it's literally,
It's the opposite.
and I
Yes.
wasn't even thinking, yeah.
Yeah. So then I fixed it. And when we gave it,
Which may be why
Wait,
he had
let him
such
get
a-
it out.
But it may be why he had such an issue with it. He may have been
he
feeling insecure.
felt
He
exactly.
was feeling insecure.
Yes,
What
exactly.
were you going to say?
So when he comes into there. My wife is part of the business, but she does the office. So she does office and all the other stuff. They go in there to talk to her to ask, tell them how much money it is. Hell no, fuck. Walks out the thing and is mad. She go, "Don't worry about it. I got this covered." So she paid the price. It was a good price. It was $10K. And so then we fixed it. And she was amazed. She came back. She said, "Ooh." And he came back, "Doc, I'm sorry. There's a difference."
Wow.
But
What's the
before that, he
recovery
didn't care.
Can I ask you, there's a psychological aspect to medicine, right?
Mhm.
And going to the doctor, and for whatever reason, cosmetology, when they feel like it's not a life or death situation, is not covered by insurance.
Mhm.
So the way you even put the price tag on this is $10K, I assume this was out of pocket.
Yeah,
Which may have
everything.
also been why he
Was upset
responded
too.
in the way that
Yeah,
it did.
that's true.
In what cosmetic OBGYN procedures would an insurance cover, if any?
If you zip
None.
your pussy up.
Yep.
None.
Yep. If you zip it up, they'll
Yeah.
do that. Yeah, they'll cover that. They'll
'Cause, like-
cover things that are
Wait,
broken.
what is a zip?
So my
what is a
mom-
zip it
They'll,
up?
they'll cover
Like
it
if
if
the
it's
labia
broken.
is that long, if it's that, it has to be like
has to be
affecting your
broken.
everyday life,
Yeah.
right?
Oh.
So my mom wants to do this facelift. I swear to you. She's like, "I just want it right here. I just want it right here. Just my eye. The skin is hanging too much." I'm like, "Mom," and my mom is 72 and she's gorgeous.
Mhm.
So she was like, "If I get to the point where I can't see no more, they gonna do my facelift free." And I was laughing about it, but she's right. Because it actually has to affect your everyday life for it to be
Uh-huh.
an insurance thing.
Wow.
But then you're going to get it under insurance, and then that doctor
It's a
isn't
different
going to
doctor.
be isn't
different
the
doctor.
one that's doing it all the time, and so you get jacked. That's the other thing. So
Save up for that pussy.
right, so like a lot of people try to do that with like labiaplasty and even these they try to cut the corner, go through insurance, and these people aren't trained on how to do these things.
So then I want to ask you then the difference between what you do in maybe a Vagisteam or a lot of these things that we can essentially go to a spa and get done now that advertises as a vaginal tightening or vaginal rejuvenation.
Yep.
As an OBGYN, what are your thoughts on these Vagisteams?
I don't like them.
I've never even heard that makes you tighter.
No?
No.
The vaginal rejuvenation, that's
Vaginal rejuvenation
Yeah.
is not the steam.
Yeah, but that's another problem
But
with
the
the
steam
vaginal
also-
rejuvenation. You don't know what you're talking about,
right.
right? Is it vaginal dryness? Is it tighten? Is it labiaplasty? Is it Majora? Is it that my clitoral hood is stuck? Is it that I
It's
can't
when they
orgasm?
sit over.
All of those
it's when
things.
they
What
sit
is
over
those
the pot.
things? Huh?
Yeah,
They
that's
sit
not a
over the
surgery
pot.
though.
Yeah, but they sit over the pot. We have now all these conversations regarding things that you should do from douching that now we're learning is not healthy
Hell
because
no,
you
that's
need your.
horrible. Should
Douching
never
is-
douche.
Can we talk about
What about
that?
douching with water?
I don't think you should douche at all.
Talk
I
about
used to. I don't do douche, but when I used to do it all the time, I used to tell my patients, they probably, you don't need to douche. It's a self-cleaning oven. There's probably the person who made the douche was this little old white
he was a white
man
man.
with
He
some
was a white man
glasses.
for sure.
Let's talk about
And
self-cleaning
said-
oven though.
Yes.
Uh-huh.
Because we've got VV that happens, right?
Yep.
And when you know your microflora is off, you know the pH is off, and you may not want to take antibiotics.
Mhm.
Boric acid, douching. There's so many different options.
Boric acid is effective treatment because all you're doing is changing the acidic pH of
But
the
they
vagina.
literally have boric acid douche.
Oh,
So-
I haven't seen those.
I haven't seen it.
Yeah, they do. I'm also asking this because we interviewed a porn star who was saying she really doesn't have issues, right? And she's like talked about pH and things like
Mhm.
that. So for me, when I've ever heard a friend of mine gets BV out of nowhere, I'm like, that nigga fucking somebody else.
Mm-hmm.
But
Mm.
There's
have-
an association between BV and multiple partners.
right.
There is.
So
Very true.
when women are coming into you and they just randomly get BV
Mhm.
with the same partner, have you ever said, maybe your man fucking with?
I'll say, Weezy, you've been here a couple times for this. I do want to share with you that the evidence suggests that women who have multiple episodes of BV, there is a potential that could be because of multiple partners. I don't know what you do. I don't know what your boyfriend does, but I want you to have that
Not only
information.
multiple partners, is there a way that the shit on his dick just don't match with my pussy?
Where you
like-
never go butt
Wait,
to
shit
ass.
on
No,
his dick.
not shit on his dick like that. I'm saying maybe
Oh, his
dick,
own bacteria.
just his own bacteria does not match with the bacteria in my vagina. Maybe it has nothing to do with other women.
That's
but
possible.
Can there be an incompatibility with just bacteria from one person to another?
Yeah, but you're going to get used to it. If you're stable, your body's going to adjust. I mean, that's going
Okay.
to change. That's going to not be forever and ever and ever.
Your pH kind of like,
No, you'll get
Balances out.
adjusted to the bacteria. She was asking about the shit
About
on the
the
dick.
bacteria.
what
So
if-
the bacteria,
Right.
your body will
We'll
become
learn.
accustomed.
Okay.
Now, what about in cases of like, sorry, what was I thinking? We hear a lot of time that, coming inside is going to give you the BV.
Mm-hmm.
But I've always kind of thought that the pH, it'll just level out. You get used to it. Is that not true?
As far as the
Like if a man coming inside of you.
yeah, exactly. You'll get used to it. But that's the whole thing about where they're talking about different partners because you're putting in different bacteria.
I have always thought BV meant you got another bitch.
Not always, but
Mm.
mhm.
Not
Change
be
the pH.
you equal. You got another bitch.
Listen, when I tell you my homegirl has had it twice this year, not this year, but twice in 6 months with the same person, I'm like,
And she's never had that issue before.
no.
Yeah.
She don't want to listen to me. She was like,
Yeah.
oh,
So then we need
he
to get her
drinks
that
a lot
study.
of soda and
Not the soda.
bitch.
Not the soda, the weed, and the hookah being to blame.
Now, what about porn stars? Because Kazumi told us she doesn't experience that. So how is that? Do you ever have sex workers come in with BV often? Because how is it not happening to them?
I haven't taken care of a porn star.
What about escorts? Nothing.
No.
Well,
How
they
you
go
know?
to they also go to talent testing. Is what
But I mean, they could have
Maybe
had
they could
children.
have
Maybe they
their
could have had
own,
a regular doctor.
Well, maybe they didn't tell me back then. I mean, I've had, it's a different way of practicing now than I did before.
Mm.
So when you come see me now, you're paying me out of pocket. Before, you're paying me with insurance. Insurance pays you differently
You
than
saying
out
these
of
rich
pocket.
hoes ain't selling pussy for real?
Yeah, I didn't say that.
The
Yes,
rich
he
hoes
is.
is selling pussy.
I
He
didn't say
said not for real.
I didn't say that.
Yes, he did.
No, I
He
didn't.
said
he
that
said he
not
bored
come
with
out
that
of my mouth.
pussy. And okay. So let's dig in a little bit more into
Mhm.
age. I feel
Sure.
like a lot of this is associated with older women. Can you tell us, for the women listening in their 20s and 30s, some of the issues that you've seen come up that surprised you with younger girls?
Let's see. Surprised me with younger women. Generally coming is going to be birth control with younger women. It's going to be
Why is that? How young? What do you mean?
well, younger women. You're talking what reproductive age? They don't want to get pregnant, so using birth control.
Oh, but you said surprise.
Can I
Oh,
ask
you mean surprise? I don't.
Can I ask you why that is the Tylenol? Can I ask you why birth control is
you get
the
a pimple.
solution for when a lot of women go into a doctor if they're flow is heavy, if their cramps are really excruciating, if anything regarding their reproductive cycle is abnormal, the solution is birth control.
That's the first step, right? They give them birth control to regulate things.
Okay.
But did they ask you a lot of questions? Did they ask you what's going on? What's happening? Did they do a really detailed history? Did they just want to quickly, and this is insurance today. Come in, we're going to do pills first. I know that's the appropriate first step. Take that, go.
But natural isn't a moneymaker.
Huh?
Like, that's the thing, too. Like, and no offense, but like for me with the hormone therapy, the first thing that when I went to the doctor, they wanted to give me shots of estrogen, estradiol cream inside of my vagina. No one ever said, why don't you try this, or that first? Like, when it comes to holistic and natural things, I feel like we can't really trust the doctor for that.
You can't.
So,
for OBGYN, you can trust them to the point, like I just told you. We're going to take care of,
in terms of how they ask you questions to really see how they care.
But you're also talking about we don't get trained about sexual wellness. We don't get trained in medicine as OBGYNs in our residency about caring for the modern day women and their concerns.
What's the modern day woman?
You keep saying that. You do keep saying
your
that.
group.
You Heaux.
No, I didn't. No, I didn't. I'm going to look at, where's the camera? No, I didn't say that.
He said JoJo group.
It starts there?
He told that PRF, get them little modern day. And she typed in whore and we popped up.
No.
The way you said we didn't get trained in sexual wellness as if sex is not the way that we reproduce. Then you said modern day women about 11 times.
Yeah, what is that? Someone who's having more sex, ain't it?
No, what it is,
single.
Okay, I'm going to explain. So the modern day,
He's all getting feisty.
What? The modern day woman wants certain things, right? They are now saying, hey, you got this show. Why? Because you want to educate women about different options and experiences, right? You want them to have intimacy. You want them to be able to experience different things, do different things, know about different things. That's the modern day woman. The other woman was left on the shelf. We weren't talking to her. We weren't telling her nothing. We weren't increasing the longevity of her vulva.
You clean that up well.
See what I'm saying?
He said a lot. Media trained.
I tell you what I mean.
No, you right. I ain't gonna hold you.
So now, so that's why we have cosmetic gynecology. See, I'm getting loud because this is what I'm passionate about. But now we have cosmetic.
We thought you was calling us hoes.
No, but now cosmetic gynecologists are saying we understand that there's more than just a pap smear and birth control. We want to help. What you're not lubing? Come here. This is what I got for you.
You're not lubing.
Right? I got this,
what is
and
it
this
again?
for you.
I'm for real. When I tell you I want to be like a waterfall, I'm back to normal. But I want him to drown.
Depending on your time of the month.
When I'm ovulating.
Drink lots of water. You drink lots of water. Your discharge changes throughout your menstrual cycle.
And do.
Yep.
No, when I ovulate, it's bad. I mean, I have to wipe it up.
Yeah. When you're ovulating is you're to get the most amount because then it makes it easier to get pregnant. The sperm can swim easier and faster.
Yeah,
now, we do have a few questions for our home mail from fans. One I thought was interesting. Is getting your eggs counted invasive, expensive, or even necessary if I'm 32 years old?
Ooh.
No, if you're having normal, regular, predictable menstrual cycles, you should be able to assume that you're having ovulation. When you don't ovulate, then your cycle will be off. If there are other changes that would make you
off?
Oh, it could be any greater than plus or minus 7 days.
Okay, a week.
Okay.
Off. Okay.
Yeah.
Okay.
I was 4 days off this month. That's why I was like, oh.
Okay.
Bro, I was planning my abortion. It was crazy. I'm not even playing. Y'all. The way that I've been out here living, I was like, one day late, I said, and he wrote me every morning, how your period came, baby? It was bad.
So I did hear that inflation didn't take heed into the abortion area. It's still like $500, which is about what I got it.
Insurance will cover it.
No. Insurance never covers abortion. Unless it is a life or death situation. I just had that conversation with my mom.
When I was 25 years old, Planned Parenthood took my insurance. And I only paid $75.
But you still have to pay.
I mean,
like it doesn't cover it.
That's a pretty good copay.
My abortion was $500. But to my knowledge, and y'all can correct me if I'm wrong. I don't mind being corrected.
I really don't hope
I've heard even from my mom, who is currently in the healthcare field, insurances don't cover abortions. Now, maybe because Planned Parenthood is one of those nonprofit organizations that are funded by people, they came in on it. But if you go to like a normal physician or a hospital. By the way, fuck that. We got a fucking OBGYN here.
Okay, yeah, thank you.
Are abortions covered by insurance?
No.
That's what I.
So the Planned Parenthood I went and got, maybe it was a
sliding
Planned
scale, most
sliding
likely.
scale. Which pretty good. So next question. I don't think I have BV, but when I'm stressed, there's a smell.
Interesting.
Go ahead. Finish.
She said, how can I eliminate this?
Well, every vagina has a little bit of a smell, just like balls have a little bit of smell to them, right?
Right.
So, I mean, that's not unusual. You want to worry about odors that are unpleasant, off-putting, discharge that's yellow, green.
I've never seen that, actually.
Can I ask you, with pheromones then, your vagina and balls, can stress change the pheromones of the smell of you? Is that normal? Does that make sense?
I think stress could change your response to an odor or smell.
Okay.
I don't know if you
So maybe she's actually not even.
But it may be just her response to that odor.
Smell. The next question. How the fuck I keep getting BV and how can I get rid of it for good?
Stop fucking that nigga.
You do that. One of the things that you when I treat that, you give flagyl, and then they do need to take rest, meaning not having intercourse. You need to treat the full course is one thing. Other things sometimes
I thought flagyl is yeast infection.
No, diflucan.
Diflucan, because that's after
or the cream.
I have to take. Yep.
Is the yeast infection.
Okay.
So you can use metronidazole, do it for 7 days, but they got to rest. You got to let the normal bacteria come back.
That's
in,
the thing, ladies. When your doctor say take 2 days of rest, bitch, give it 4. Calm down. Don't get right into heaven.
Give it some rest.
So we got 2 more.
Mm-hmm.
Why don't we get anesthesia or pain meds for an IUD insertion?
Ooh. Yeah, I've heard that one a lot.
Is that because of the cost?
No, I don't think it has to do with the cost. I used to use it. The thing, some of it just has to be with training. This is the difference in mindset that some of the physicians are doing. So if you're doing it in the hospital, you're just trying to quickly get it done and do it. You're coming to see me. I can't afford not one of y'all to talk bad about me. Right? So when you come, you got this. Let me give you some water. I'm going to numb you up real good. There's a difference in how you practice.
Okay.
Yeah.
It's the difference from when you go to a hair braider and then a bitch with her own salon.
There you go.
You get
what? These bitches be charged $800.
No, they do. But you get the mimosa and the wine in between.
Right.
You know what I mean?
Yes, absolutely.
How
it says, okay.
HSV. Is it possible to conceive children with someone diagnosed with HSV?
Yeah, herpes, absolutely. You can get pregnant when you have herpes. You can deliver vaginally if you have herpes.
I felt like I knew the answer to that, but I think maybe people didn't.
They don't. They must not. Well, I used to get that question all the time. Herpes.
Well, I think also because they still align HSV with HIV as one of the things you don't get rid of, right?
Mm-hmm.
And so the way that we have been brought up to really think about how we view STDs, we know that herpes and HIV are the 2 that you can't get rid of.
Right.
Everyone now looks at chlamydia, gonorrhea, everything else is, I can
get rid of it. Yeah.
And so
listen, that fucks up those fallopian tubes now.
Yeah. Chlamydia will kill it. Silent
pill.
Yep. Silent killer of fertility.
If you're there, and can you speak on that a little bit? Because again,
about chlamydia?
Chlamydia sometimes may not have an itch, a scratch. You may not even know you have it again without being tested. But the silent killer, can we talk about a little bit why, and also why we don't view chlamydia as so dangerous?
Well, I think they need to start. It's easy. That's the exact reason they think they have it now. You can mix a drink it once.
For real?
Yeah. A 1-gram slurry, put in a little bit of water, drink it. Boom.
Not emergency.
Yep. Now you can take 2 tablets and get rid of it.
I haven't had an STD in years, maybe early 20s. I think I had it. And I get tested so regularly. And one of my homegirls made a joke with me, like, ain't no way.
Oh, they said, yeah.
Ain't no way. And I'm like, damn, bro. But she was like, telling me, she's a naturopathy doctor. She was like, I think chlamydia nowadays, it can be so mild. Maybe it's going away on its own with people.
No, let's be very clear.
No, like really, she said that. She's like, if you've taken an antibiotic in your life, if you've had, because trichinosis has become so rampant.
That's the one.
Literally. And again, she's naturopathy. She was like, I believe you've either had tests in your life that probably didn't pass. You probably had another antibiotic.
She told you this?
She was saying that it's...
She's saying this because you're so sexually active that there's no way
she's saying that the amount of women that are coming in with more than 2 or 3 partners in a year.
Okay.
It's happening. Metropolitan cities, it's growing.
Right.
Even open relationships, she's like, that's the most common. People that are having promiscuous sex with a partner or not.
I mean, there's gonorrhea and things that are now coming to where they're saying that now the medication that they've created
Superbugs.
is not because it's turning into like COVID, where it's growing to where,
Superbugs, yep.
what is it called?
They're just superbugs. Where
Superbugs.
they're not responding to traditional antibiotics, and we have to
Ooh.
go and figure out different ways to give you the antibiotic to treat you.
I'm about to tell you this. One of my friends just had an STD. Hold on, wait. This motherfucker was like, bro, I never seen this shit before. I don't even know if what I'm supposed to do. Okay, hold on. No.
I was about to say, what is we about to do?
That person sent the name of it, and I was like,
oh, it's a new STD you never
what
heard of?
is this, Haney? And we were all laughing about it, you know what I'm saying? Because they were like, yo, like, this is not coming up on regular
You don't
tests.
even know how to spell it. The way she is going through group chats, screenshots, Instagram,
Right, it's bad.
Google.
Hold on.
What is the name of this STD? Because I need to know what superbug is out here.
Doc, I need you to
I
help
just
us.
got back into these streets.
There
What
it
is
goes.
the superbug? What's the name of
I
that?
circled it. You see it?
Urea plasma and urolyticum. Yeah.
No,
Well,
what
that's-
the hell is that?
That's just it's a bacteria that
What
is
is
in
your-
the vagina.
In your
You
urethra?
look like that.
No, that's just the name of it. It's
Oh,
just
okay.
it's just another bacteria.
Okay.
Sometimes you see BV with it as well, but you just treat it with antibiotic. It's just another.
But so
How do
let
we
me
not know about
wait. This friend got sick on a trip to Paris.
Mm-hmm.
Got a blood
You giving a lot of details on a trip out
This
of.
person is not on Instagram. It does.
Okay.
So this person got sick on a trip to Paris, got this test there, and was
Mhm.
like, I've been tested like 5 times in the States. Never did this come up. That thing that you just read, I don't know what the fuck that is. Is it possible that we could be passing something like that amongst each other and have no idea because it's not
Because the U.S. doesn't test for it.
Like, is that something that you've been seeing in tests, or is it because we're not doing?
Usually, I would see that in the urine though. When I used to run across that, when I would see it in the urine.
But like we know that they don't test
I'd
for
never- what-
HSV unless you ask for it, and HIV is the same.
Right.
So is this something that potentially doesn't go through screening?
No, I don't think that.
Bruh, look at this.
Uroplasma
Liticum.
urolyticum.
Yep.
What's the short word for this?
UTI?
Uroplasm.
That look like
Urolyticum.
UTI?
Mycoplasma hominid. So then, they were like, yo, do I need to hit on my partners right now? And I'm like, bruh, if they got tested on. Wait, you said no?
Yeah, it's just like a bacteria. There's
Wait, for this you would say
I don't-
you wouldn't have to hit up your partners for.
I don't think so.
Which STDs? Oh, interesting. If you feel like if someone has to get antibiotics for an STD, you feel like there are STDs that they don't have to tell their partners that they're taking antibiotics
That's
on?
not what I said.
So let's.
He said, bitch, I said that one.
Huh?
But
Lisa.
why this?
Rice.
Why this one? But why this one would you not have to tell your partners?
Because it's just there's a whole bunch of bacteria that have these really crazy different names. It's just
So that's not an STD.
no.
Interesting.
No,
That
I would
was
have to
not-
double check. But I mean, I'm a little bit away from it. But in my as I recollect, this is not associated with.
Which is probably why we
penis,
don't know the
vagina.
name.
Wait, so it could just be a bacteria
It's
that
in
maybe
the bladder, and that was cultured and showed up, and they said, "Oh shit, that's uroplasm, urolyticum. Let them know and teach them and treat it."
Okay,
It's kind of like that kind of
okay.
thing.
Bruh. Well, that motherfucker's gonna have to make a lot of calls because that whole yeah, yeah.
Yo,
Anyway.
chill.
What? Nobody knows who it is. You're allowed to talk shit about people if no one knows who it is.
We're podcasters. This is what we do.
Anyway, Dr. Reed, please tell people where to find you. We know you're in Sacramento, so maybe some of our whore hive there could come and visit you.
And we have a really
I would
large
love
whore hive in the Bay.
Yeah, please come. I'm in Davis, California. You can find me at thecosmeticgyn.com, drmichaelreed.com.
You better have $10,000.
I am a
Take
little
your insurance.
expensive. I am, but I mean, I do some really good work, and I'm really educated, and I can really take care of a whole bunch of things. And what you get from me is that warrior that's going to fight for you so that you can have what you want to have and improve the longevity of your vulva.
Well, I would like a free Zoom because I ain't got. We been going to. I go to walk-in gyno too. I'm tired of that bitch.
I also want to say I think it's important for us to create more of this network where we support doctors and OBGYNs
For sure.
and physicians that look like us.
I do want to plug this. I mean, it's not, but why I want to plug it because it's in line, and you can always cut it. It's in line with what I'm trying to do.
We ain't gonna cut you. Don't do that.
It's called the Institute of Restorative and Cosmetic Gynecology. It's a training program that I started. This training program. And what we do is we bring physicians in, right? 10 of them. We have cadavers. I give lectures.
Mm-hmm.
I tell them about the anatomy, how you do these procedures correctly.
You take them to school.
And yes. And then they go into the lab.
Wow.
And then we practice on a human being, of course, a cadaver, but we at least have that much training. You don't get any of that kind of training when you come out of residency. So I've started this institute to train doctors to be gladiators for the modern day woman.
You host.
For you,
Hold on. I'm going to use this tonight. What this going to do to me?
Okay, look, go ahead and explain.
I got to use a mixing bowl and put this shit in my pussy?
Yeah, so this is CO2 Lift V.
It's going to burn?
CO2, it's giving chemistry. I'm going to let you do this. Go ahead.
CO2. They also have CO2 Lift, which you could just
shit.
use on the face. You can use this on the vulva.
What's it going to do?
So it helps with moisturizing. Remember you're talking about...
don't say no
your dryness.
This will help you.
A dry pussy hole.
I used to be. It's back.
This will change your life.
You fitting yourself with the CO2, bro.
You do that 5 days. There should be 10 packets, right?
Can I have sex in between?
You're going to do it. So this is how you do it. You mix it. You're going to do it at night. You're going to mix packet 1 with packet 2 in a bowl. Mix it. It'll be orangish in color. You're going to put it inside the vagina and put a little bit on the outside of the vagina.
But you about to turn
and then you're going to
orange.
jump in bed. So you're going to do it after you've had sex.
Oh.
So I can make sure you don't come over. Okay.
All right. And then
I got it 5 days before. Why? I'm good.
once you get in bed, you can't go on all over the place because it tightens up kind of like a face mask. And then what you do is at dark 100, when you get up to go pee, it'll plop in the toilet. Then you jump in bed. And then when you wake up in the morning, shower, it's gone.
Wait, you got to pee it out first?
Well, when you go pee, it'll plop
I ain't gonna hold you. That's like when you take cranberry pills, your piss turn orange.
Bro, how many?
It's like the same shit.
Okay, so it's 5. Where's
Hey Wolf, can we get some BTS of this from Patreon where she mixed it in the bowl and you like blur out her putting it on her pussy and we see a facelift on her pussy?
I can't use both of them?
No, that's the whole idea. There should be 5 of them.
Yep. See?
I put the little one. These directions ain't good enough.
You take one big, one little.
One big, one little.
Mix them. Stir them up. There's a syringe in there, isn't there?
Uh-huh.
Oh, you about to shoot it up your pussy.
Yep. Push it into the vagina. And then you're going to rub whatever's left in the bowl all over the vulva. Just indiscriminate. Just put it on there.
I break my pussy, I'm going to tag you.
You can tag me. You better call me and let some people know it changed and it was because of Dr. Reed.
When I tell you I'm going to Hawaii and I'm trying to look like the ocean.
Oh,
you trying to look like the ocean. Is
for real. And honestly, I've never talked about what I experienced on Horrible because it had to do with me taking antidepressants. And I was like, I just don't really want to get into it. But now that my pussy's back, I'm cool to talk about it. We'll see. We'll see if you about what you be talking about. We're going to find out if that degree fake.
I know I am. You'll call me.
Oh.
Thank you, Dr. Reed. We enjoyed this episode so much. Y'all, please go check him out if you're in the area. You have any questions, or even if, you take a little trip to get your pussy done, get your little designer pussy.
Yeah.
But also, if you want to see Weezy's pussy, join us on Patreon because maybe she'll do some BTS of this experiment on her vagina.
Mandy's full of shit.
Join us on Patreon. That's patreon.com/horrible decisions, where we have bonus episodes every week on top of BTS and other things. We're creating other shows over there, so join us in support of us. And this has been yet another episode of Horrible Decisions.
Bye.
It's bonus, bitches.
For those of you niggas that aren't spending another $5, we are now in 4K, 6K, or 6K if you're nasty. So upgrade to the next tier to see this episode on video. And if you're already looking at us, you're welcome because my titties are out.
Are they? Yeah, they are kind of out.
Sorry, hold on.
And baby, I'm in here with a goddamn hoodie and sneakers because this weather is ridiculous. I just got back from fucking Miami and I didn't know that I was coming back home to a snowstorm.
Was it fucking Miami or what?
It was sucking Miami.
Why wasn't it fucking?
Girl, because the nigga got too drunk and threw up all over himself. So no dick took place there. So yeah, and he's just like, I feel so terrible. And I'm like,
You should.
Yeah, you should. But also,
wait, how was it sucking? So
because I sucked him before the Super Bowl, but then we had to all go watch the Super Bowl. And so we
Did he come?
oh girl, came. like came, and I had fun with it. Like I had my homegirl sit on the couch while I did it. Cause he kind of like, I'm trying to inch him to a threesome. He hasn't had like a threesome.
Did she want a threesome with him?
We fucked already before though. So I was like, girl, just come downstairs and watch me suck this nigga dick real quick. And so it's so funny because he was so nervous. And that's like my homegirl. So she was like, yes, bitch, that shit sound wet. You doing that thing. But no, I literally was like, girl, just come down here and watch me suck this nigga dick real quick.
Why didn't she join in and start sucking dick?
No, because he was so nervous, even that. Like, he's sitting there and, bitch, the game just started and I'm like, nigga, you ain't finna make me miss Usher. We gotta go to this party. So I'm like going at his pants and he literally just pulled it out. Then it's just sitting on his chest. So I like just go to start sucking it. His dick is ginormous. His dick is amazing.
Okay, so it was a good dick to watch.
No, his dick is great. Well, no, she felt nervous to even look because he was so nervous. Bitch, he was just like this. Like, he was so... Bitch, he was so fucking nervous. I was just like, oh my God, this is so annoying.
Wait, set the scene. So are you staying in the room with him?
No, he gets me on. That's why she came. I get my own room every time he flies me out.
Why?
What do you mean, why? Because I do. And I sent him my first class ticket. I don't need to be all up under your shit. And I wanted to be with my friend. Like, I had invited her to the game. And he, I was driving around with her. So I got my own room. When I went to when I go to, like, anywhere I go, I get my own room. And so I'll go to his room or he'll come to mine. But we don't sleep together. Like, we don't do all the cuddling and shit. It's
okay,
new.
So anyway.
Yeah, we don't do that.
Well, no, you said it's new, but normally you do it.
Well, it's not new. Like, it's the nigga that I would go and see, like, when my ex was.
So you guys both come downstairs. Does he know she's coming downstairs?
We went upstairs.
Wherever, sorry.
He knew.
He was on a pirate
no,
bed.
he knew. He said both of y'all come down, and I was like, okay. And of course, he was like, you trust her? I was like, bro, I'm not gonna bring nobody around that I don't trust. So,
but wait, hold on. So he knew you were coming down to suck his dick.
Yeah.
Okay.
That's what I was coming down for.
Because that's what I'm like, if he said both of y'all come down, why you coming down scary?
For? Because he's scary. He's just scary. I couldn't imagine. I would not be the hoe I am today if I had to go through that type of party and shit that these girls have to go to. Literally, for y'all, I'll share what the experience is like. So a lot of like basketball players now don't like going to clubs because there's phones, they get drunk, they get shit-faced.
They literally make one. It's crazy.
They make clubs. So they'll like turn a restaurant or like a lounge into their own club. There'll be a DJ, there'll be an open bar, there's bottle service, there's hookah, there's all the things. Except for niggas.
The bottle service part is the weirdest part.
It's weird. They were coming out with sparklers,
I
bro.
went to one at the Mondrian. It was like, you know, when they were, I don't know if you've been to one of those.
I don't know.
But basically at the Mondrian in New York, there's this top floor. It's probably like a lounge anyway, but it turns into a club. So I walk in and I didn't know that type of party it was. I knew a ball player invited me, but I just kind of thought he was having drinks with friends because we not fucking with each other. So it didn't really, he was like, yo, I'm in New York too, come through. So the bodyguard or the security looks at me and he's like, okay, she's cute, but is she invited to this party? I was like, I'm looking for my friend so-and-so. And he's like, okay, well, you'd have to go upstairs. I was like, okay, cool. And then he's like, well, I need your phone. And I'm like, no, I have to meet him up there.
No, they collected everyone's phone and put them in white envelopes. But like the party is literally just the team, maybe the players like Du Bois, and maybe a coach or two, or like one of the people that work on the team. There was literally 10 niggas in this room. That's it. And easily 150 bitches.